Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
In this video, I will explain how to use iodine cotton swabs, updated. Clean the area first, shake the swab if needed, and apply a thin layer of iodine with gentle circular motions until the skin is evenly coated. Allow it to dry for a minute, then cover if needed. Avoid contact with eyes or mucous membranes and discard the swab safely after use. Consult a healthcare professional for deep wounds or signs of infection. Before using iodine swabs, wash your hands and prep a clean workspace to avoid contamination. Remove any makeup, dirt, or moisture from the area and dry gently. Read the swab label for active ingredient and warnings and test a small spot if unsure. Keep a small bandage and sterile gauze nearby for post-application. Store unused swabs in a cool, dry place away from children. Dispose of used swabs according to local guidelines. Quick recommendation: if you are finding this video helpful, please subscribe and like to support the channel. Speaking of staying clean and refreshed, I love the Oala water bottle because it keeps water cold and is easy to carry on the go. It's a simple, practical pick to stay hydrated while treating wounds. Check the description for the link and other deals, and now let's get back to the video. Use short, light strokes with the iodine swab and avoid pressing hard to prevent irritation. For small cuts, swab from center outward to move debris away while coating the wound. For larger areas, work in overlapping passes to ensure even coverage. If pain or intense redness occurs, stop and seek advice. Remember to replace gloves or wash hands between different sites to prevent cross-contamination. Label any treated area if you will reapply later.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.